So at Krause Comprehensive Dental Care, one of the things that we've really been looking for a little bit more nowadays, the more that we learn, is sleep apnea. And what we've found over time is that this is no longer the disease of fat old men. This is really a disease of the patient's individual anatomy. I've seen very fit patients that their anatomy is such that they have sleep apnea. And the first couple times I saw this, it was really an eye-opening finding for me, and starting to realize that sleep apnea is one of the most underdiagnosed conditions that is across our country. So there's a couple different things that we can do to try to help patients who have sleep apnea get a better night's sleep and improve their overall health. One is an oral appliance, and that's something that's a really nice option because we can basically make an appliance that will help position the patient's jaw a little bit more forward, and in doing so open the airway. These appliances are super adjustable, so we can always do tweaks if need be over time. But for the most part, for a lot of patients, this is kind of a set it and forget it solution, and then they only come in if they have problems down the road, or if they're not sleeping as well, or if their partner notices they're snoring. Another great option that we have for dealing with sleep apnea patients and trying to improve their health is NightLase laser sleep apnea treatment, which actually works as a way to tighten a lot of these tissues in the mouth that act to close the airway, so we can get a little bit better level of resting muscle tone of all those areas, the soft palate, the back of the tongue, the floor of the mouth, so that everything situates a little further away from each other, which helps keep the airway open. This is a great treatment because patients don't have to wear anything. Both of these treatments are really designed to get people away from CPAP, which notably has really poor compliance. These are much easier for patients to be compliant with. The laser treatment, while you may not have to wear anything depending on the starting condition, does require a little bit of upkeep. So patients will generally have to come in every 6 to 12 months after their initial treatment for touch-up treatments, but it is great in that a lot of patients may not have to wear an appliance. So those are the two ways that we generally try to address sleep apnea here in our office.